ExamPrep.School. Maine Accident and Health Insurance Producer Exam, exam code 12-ME-42. There are 4 practice exams in this series. This video covers Practice Exam 1. The first 20 questions are free. In this video, we will be covering the following major categories for Practice Exam 1. Field underwriting procedures, Maine laws and rules, common to life, accident and health, Maine laws and rules, pertinent to accident and health insurance only, other insurance concepts, policy provisions, clauses, and riders, social insurance, types of policies. Let's walk through the format. I'll read each question and its choices. Let's get started. Question 1. Which statement most accurately distinguishes the own occupation definition of disability from the any occupation definition in individual disability income insurance policies? A. Under own occupation, benefits apply if the insured cannot perform duties of their specific occupation. Under any occupation, benefits apply only if they cannot perform duties of any gainful occupation for which they are suited. B. Under own occupation, benefits apply only if the insured cannot perform duties of any gainful occupation. Under any occupation, benefits apply when they cannot perform duties of their specific occupation. C. Under own occupation, eligibility is based on factors like education and age. Under any occupation, eligibility depends solely on medical inability. D. Under own occupation, benefits are payable only for total disabilities. Under any occupation, partial disabilities trigger a partial benefits. A countdown circle appears in the top right. Once it completes, the answer is revealed. You can pause at any time if you'd like longer to think. If you'd like additional practice covering more topics, see the description for our book. The correct answer is A. The own occupation definition provides benefits when the insured cannot perform duties of their specific occupation, whereas the any occupation definition requires inability to perform any gainful occupation for which the insured is suited. Reason B is not correct. This option reverses the definitions, attributing the any occupation criteria to own occupation. Reason C is not correct. Both definitions consider reasonable suitability, not factors like education and age and isolation. Reason D is not correct. Neither definition inherently distinguishes between total and partial disability benefit triggers. Question 2. How does selecting a shorter elimination period affect the premium and commencement of benefit payments under a disability income policy? A. It increases the premium and accelerates the start of benefit payments. B. It decreases the premium and delays the start of benefit payments. C. It increases the premium and delays the start of benefit payments. D. It decreases the premium and accelerates the start of benefit payments. The correct answer is A. A shorter elimination period reduces the waiting time before benefits begin, but increases the policy premium because of higher insurer risk. Reason B is not correct. It incorrectly suggests a lower premium and delayed payments, reversing the risk-premium relationship. Reason C is not correct. It correctly links a premium increase but wrongly states that benefits are delayed rather than accelerated. Reason D is not correct. It inverts the risk-based pricing by implying premiums decrease with a shorter waiting period. Question 3. Which benefit period option typically allows the longest duration of monthly benefit payments in an individual disability income policy? A. 10-year period. B. To age 65. C. 5-year period. D. 2-year period. The correct answer is B. Among standard benefit period choices, only the to age 65 option provides the longest duration of monthly disability benefits. Reason A is not correct. A 10-year period, while substantial, is still shorter than the to age 65 option. Reason C is not correct. A 5-year period is mid-range and does not extend as long as to age 65. Reason D is not correct. A 2-year period is one of the shortest standard benefit durations. Question 4. Under common residual disability provisions, how is the residual benefit amount calculated? A. Pre-disability earnings minus current earnings, divided by pre-disability earnings, then multiplied by the full monthly benefit. B. Current earnings divided by pre-disability earnings, then multiplied by the full monthly benefit. C. Percentage of impairment assigned by medical examiner, multiplied by the full monthly benefit. D. Days disabled in the month divided by days in the month, then multiplied by the full monthly benefit. The correct answer is A. Residual benefits equal the proportionate loss of earnings times the full benefit. Pre-disability earnings, current earnings, divided by pre-disability earnings multiplied by full monthly benefit. Reason B is not correct. It reverses the formula by using the ratio of current earnings rather than the loss of earnings. Reason C is not correct. It substitutes impairment ratings for actual income loss, which is not how residual benefits are determined. Reason D is not correct. It applies a time-based proration instead of the earnings-based calculation, typical under residual provisions. Question 5. A disability income policy includes a 30-day elimination period and a recurrent disability clause defining a recurrence as the same illness or injury that reappears more than 90 days after returning to work. Emma was disabled for 60 days, returned to full-time work, then 100 days later suffered the same injury and filed a new claim. Under the recurrent disability clause, Emma's elimination period will A. Not restart because the initial elimination period has already been satisfied. B. Not restart because the recurrence occurred within the defined recurrence period. C. Restart only if the subsequent disability involves a different body system. D. Restart because the disability recurred after the specified recurrence period. The correct answer is D. The recurrent disability clause stipulates that a new elimination period applies when the recurrence occurs after the defined recurrence period has elapsed. Reason A is not correct. The clause overrides prior satisfaction of the elimination period when the recurrence occurs beyond the period. Reason B is not correct. The recurrence happened outside the defined recurrence period, so the elimination period must restart. Reason C is not correct. Recurrent disability provisions depend on timing, not on whether a different body system is involved. Question 6. After 3 years of industry-wide claim experience, led an insurer to increase premiums on its guaranteed renewable disability policies, Marcus wants a policy that guarantees both fixed premiums and that the insurer cannot cancel his coverage. Which type of disability income policy should he choose? A. Non-cancelable disability income policy. B. Guaranteed renewable disability income policy. C. Optionally renewable disability income policy. D. Conditionally renewable disability income policy. The correct answer is A. A non-cancelable disability income policy guarantees level premiums and prevents the insurer from canceling or altering policy provisions for the life of the contract. Reason B is not correct. Guaranteed renewable policies allow the insurer to increase premiums by class on renewal. Reason C is not correct. Optionally, renewable policies permit the insurer to refuse renewal at its option. Reason D is not correct. Conditionally renewable policies restrict non-renewal to specific conditions, but do not guarantee fixed rates. Question 7. Which feature is characteristic of a major medical policy but not typically found in basic medical expense coverage? A. A fixed daily hospital indemnity schedule. B. A corridor deductible applied after scheduled benefits. C. A coinsurance requirement following the deductible. D. A separate surgical benefit schedule. The correct answer is C. The correct answer is that a major medical policy includes coinsurance after the deductible, whereas basic medical expense coverage limits benefits by scheduled amounts without any coinsurance provision. Reason A is not correct. A fixed daily hospital indemnity schedule is a hallmark of basic medical expense coverage rather than major medical. Reason B is not correct. A corridor deductible is an optional layer between benefit levels, not a defining absence in basic schedules. Reason D is not correct. A separate surgical benefit schedule reflects the scheduled payment approach of basic plans, not the comprehensive nature of major medical. Question 8. Which deductible requires the insured to satisfy a separate amount for each individual claim or service before benefits are payable? A. Corridor deductible. B. Calendar year deductible. C. Per occurrence deductible. D. Integrated deductible. The correct answer is C. The correct answer is that a per occurrence deductible must be met separately for each covered claim or service, whereas calendar year and integrated deductibles accumulate over the policy term. Reason A is not correct. A corridor deductible applies between basic and major levels of coverage, not on each claim. Reason B is not correct. A calendar year deductible is satisfied once per policy year, regardless of the number of claims. Reason D is not correct. An integrated deductible aggregates all eligible expenses into a single deductible amount for the term. Question 9. Under a typical major medical coinsurance provision, what percentage of covered expenses does the insured pay after meeting the deductible? A. 10%. B. 25%. C. 20%. D. 30%. The correct answer is C. The correct answer is that most major medical plans use an 80 divided by 20 coinsurance split, meaning the insured pays 20% of covered expenses after satisfying the deductible. Reason A is not correct. A 10% share corresponds to a 90 divided by 10 split, which is far less common than an 80 divided by 20 arrangement. Reason B is not correct. A 25% share reflects a 75 divided by 25 split, which is not the standard for most major medical plans. Reason D is not correct. A 30% share corresponds to a 70 divided by 30 split, and is not the typical coinsurance ratio. Question 10. Carlos has a preferred provider organization plan with an annual deductible of $1,000 and 20% coinsurance, plus an out-of-pocket maximum of $5,000. Having already met the deductible and paid $3,200 in coinsurance, he now incurs a $2,000 medical expense. How much will Carlos pay out of pocket for this expense under his policy? A. $0. B. $400. C. $800. D. $1,600. The correct answer is B. The correct answer is $400 because Carlos has $1,800 remaining before reaching the out-of-pocket maximum. 20% of the $2,000 expense equals $400, which is below the remaining limit. Reason A is not correct. 0 is incorrect because Carlos must still pay the coinsurance portion until his out-of-pocket max is reached. Reason C is not correct. 800 is incorrect because 20% of $2,000 equals $400, not $800. Reason D is not correct. 1,600 is incorrect because it reflects 80% of the charge instead of the required 20% coinsurance portion. Question 11. A member of a health maintenance organization was referred to a specialist without obtaining prior authorization and received a $1,200 bill for the visit. The specialist's claim was subsequently denied for lack of pre-authorization. What is the most likely outcome for the patient under these circumstances? A. The insurer will pay the claim at the in-network allowed amount, and the patient pays coinsurance. B. The insurer will suspend payment until retrospective authorization is approved. then pay the full amount. C. The insurer will pay nothing, but the provider cannot bill the patient under anti-balance billing rules. D. The patient is responsible for the full $1,200 charge since pre-authorization was not obtained. The correct answer is D. The correct answer is that the patient is responsible for the full charge, because managed care plans generally deny claims entirely when required. Pre-authorization is not obtained, making the member liable. Reason A is not correct. Paying at the in-network allowed amount is incorrect because the claim is denied in its entirety when pre-authorization is missing. Reason B is not correct. Suspending payment until retrospective authorization is incorrect because most plans do not permit retrospective pre-authorizations to override a denial. Reason C is not correct. Prohibiting provider billing under anti-balance billing rules is incorrect because those rules do not apply when a claim is denied for administrative reasons. Question 12. Which of the following statements best describes the standard cost-sharing requirements under Medicare Part A and Medicare Part B? A. Medicare Part A has no beneficiary coinsurance for the first 90 days of inpatient care, and Medicare Part B includes a per-service deductible with no coinsurance. B. Medicare Part A imposes a 20% coinsurance on inpatient stays after the third day of each benefit period, and Medicare Part B requires no beneficiary deductible. C. Medicare Part A requires payment of the inpatient hospital deductible once per benefit period, and Medicare Part B has a calendar year deductible, followed by a 20% coinsurance for covered services. D. Medicare Part A requires a calendar year deductible for inpatient services, and Medicare Part B charges a flat copayment for each outpatient visit. The correct answer is C. The correct answer is that Medicare Part A requires a deductible per benefit period for inpatient hospital services, while Medicare Part B requires an annual deductible followed by a 20% coinsurance for covered outpatient and physician services. Reason A is not correct. This choice misstates that there is no inpatient coinsurance for 90 days and that Part B has no coinsurance, both of which are incorrect. Reason B is not correct. This choice incorrectly states that coinsurance begins after the third inpatient day, and that Part B has no deductible, both of which mischaracterize actual cost sharing. Reason D is not correct. This choice wrongly describes Part A as having a calendar year deductible, and Part B as using flat copayments instead of coinsurance. Question 13. Which of the following best describes the federal standardization requirements for Medicare Supplement, Medigap plans? A. Premium rates for standardized Medigap plans must be community rated across all age groups. B. Each standardized Medigap plan offers identical benefits regardless of the insurance company issuing the policy. C. Insurers may vary the deductible amount in standardized Medigap plans D and E to reflect local cost differences. D. Standardized Medigap plans are allowed to include prescription drug coverage. The correct answer is B. The correct answer is that standardized Medigap plans provide the same core benefits for each plan letter nationwide, regardless of issuing insurer. Pricing methods and additional state-mandated benefits may vary by carrier. Reason A is not correct. This choice incorrectly asserts that community rating is mandatory. Insurers may apply attained age or issue age rating where permitted. Reason C is not correct. This choice wrongly implies that core deductibles can be altered by insurers. Standardized plans have fixed benefit structures. Reason D is not correct. This choice is incorrect because standardized Medigap plans do not include prescription drug coverage, which is provided through a separate Part D benefit. Question 14. Which of the following correctly describes the Medicare Supplement open enrollment period rights? A. It starts on the date of initial Medicare Part A enrollment and lasts 3 months, allowing coverage to be denied based on health status. B. It is a 6-month period that begins the first day of the month in which a beneficiary turns 65 and enrolls in Medicare Part B, during which insurers cannot use medical underwriting or charge higher premiums due to health status. C. It begins with Medicare Part B enrollment and lasts 6 months, but insurers may impose a 6-month pre-existing condition waiting period. D. It commences immediately after Medicare Part B enrollment and continues indefinitely, during which beneficiaries are guaranteed issue only if previously covered under an employer plan. The correct answer is B. The correct answer is that the Medigap open enrollment period lasts 6 months starting the first day of the month. The beneficiary turns 65 and has Part B, during which no medical underwriting is allowed, and premiums cannot be increased for health reasons. Reason A is not correct. This choice misstates the start date and duration, and wrongly allows underwriting during the period. Reason C is not correct. This choice incorrectly suggests a pre-existing condition waiting period, which is prohibited during open enrollment. Reason D is not correct. This choice falsely indicates an indefinite period and restricts guaranteed issue to prior employer coverage. Question 15. Joan Smith first enrolled in Medicare Part B on January 1st, 2022. Her retiree group health coverage terminated on May 15th, 2023. She submitted a Medicare supplement policy application on August 17th, 2023. Based on guaranteed issue rights following loss of group coverage, which statement is correct? A. Coverage applies to repair of the chairs as part of property damage from the product's hazard. B. The insurer may require medical underwriting because the application was submitted more than 63 days after losing group coverage. C. She has lifetime guaranteed issue protection after loss of group retiree coverage, regardless of when she applies. D. She is guaranteed issue if she applies within 6 months of losing her group coverage. The correct answer is B. The correct answer is that after losing retiree group coverage, the guaranteed issue period lasts only 63 days. Because the application was submitted 94 days after the termination date, the insurer may impose medical underwriting. Reason A is not correct. Initial Medigap open enrollment runs for 6 months after Part B begins and expired in mid-2022, so it does not apply to this application date. Reason C is not correct. Guaranteed issue rights following loss of group coverage are not lifetime. They require application within the 63-day special enrollment period. Reason D is not correct. The special enrollment period for loss of group coverage is 63 days, not 6 months. Question 16. Which of the following is not one of the activities of daily living AD-ELS criteria typically used to trigger eligibility for long-term care insurance benefits? A. Bathing. B. Dressing. C. Continence. D. Managing finances. The correct answer is D. The correct answer is managing finances as ADL criteria focus on personal physical tasks, such as bathing, dressing, and continence. Reason A is not correct. Bathing is one of the core ADLs used to assess eligibility for long-term care benefits. Reason B is not correct. Dressing is a primary ADL criterion for determining long-term care need. Reason C is not correct. Continence management is included among the ADLs that triggered long-term care benefits. Question 17. Which of the following levels of care in long-term care insurance policies is characterized by non-medical assistance with activities of daily living provided by aides rather than licensed nursing professionals? A. Skilled nursing care. B. Intermediate care. C. Custodial care. D. Respite care. The correct answer is C. The correct answer is custodial care, which provides non-medical personal assistance with ADLs without skilled nursing services. Reason A is not correct. Skilled nursing care requires licensed nursing staff under medical supervision, not just personal assistants. Reason B is not correct. Intermediate care includes occasional professional medical services, making it more intensive than custodial care. Reason D is not correct. Respite care is short-term relief for caregivers rather than a defined level of ongoing ADL assistance. Question 18. Ellen, age 82, has been diagnosed with Alzheimer's disease, and her physician notes she frequently wanders and is unable to recognize familiar surroundings, requiring someone to stay with her for safety. Under the policy's cognitive impairment trigger, when are long-term care benefits payable? A. When she is unable to perform at least 2 activities of daily living due to cognitive decline. B. When a physician certifies that she needs substantial supervision to protect her own health and safety. C. When she scores below the policy's cut score on a standardized cognitive assessment. D. When she requires standby assistance for medication management. The correct answer is B. The cognitive impairment trigger is met when a physician certifies that the insured's severe cognitive loss requires substantial supervision for safety, satisfying the policy's qualification for benefit payment without needing an ADL loss. Reason A is not correct. An inability to perform ADLs is an ADL trigger, not the cognitive impairment trigger. Reason C is not correct. A low score on a cognitive test alone does not satisfy the policy's requirement for documented need for supervision. Reason D is not correct. Standby assistance for medication is a care need, but does not by itself meet the policy's substantial supervision requirement. Question 19. Under the entire contract clause in a health insurance policy, which of the following documents is explicitly included as part of the complete contract? A. The policy, any attached riders, and the original application. B. Benefit summaries, outlines of coverage, and producer reports. C. The policy, subsequent amendments, and all claim forms. D. Only the policy and endorsements issued after delivery. The correct answer is A. The entire contract provision specifies that the contract consists of the policy, any attached riders, and the original application. Other documents like benefit summaries, producer reports, endorsements after delivery, or claim forms are not part of the contract. Reason B is not correct. Benefit summaries, outlines of coverage, and producer reports serve informational purposes and are not contractual components. Reason C is not correct. Subsequent amendments require formal endorsement, and claim forms do not form part of the contract language. Reason D is not correct. Limiting the contract to just the policy and post-delivery endorsements omits the application and riders that are expressly included. Question 20. Under the time limit on certain defenses provision, for how long may an insurer contest misstatements in a health insurance application? A. 1 year from the policy issue date. B. Indefinitely for any material misstatements. C. 3 years following policy delivery. D. 2 years from the date of issue or reinstatement, except in cases of fraud. The correct answer is D. The time limit on certain defenses provision restricts contestability of application misstatements to 2 years from issue or reinstatement, except when fraud is involved. After that period, non-fraud misstatements cannot be used to void or deny a claim. Reason A is not correct. A 1-year period understates the standard 2-year contestability timeframe. Reason B is not correct. Non-fraud misstatements cannot be contested indefinitely once the contestability period ends. Reason C is not correct. 3 years exceeds the statutory limit for contesting misstatements. Enjoyed this practice test? Tap like, hit subscribe, and share it with a classmate. Got a question we should tweak? Comment below. We read them all. Find full practice exam books in the description or at ExamPrep.School.